morning and welcome. I'm Alan Jetty, and it's my pleasure, along with my colleague Jack Rowe, to welcome you to this workshop on fostering independence, participation, and healthy aging through technology. We're delighted and really appreciate that all of you have taken the time out of your busy schedules to be with us today. We know this is a busy time of year, and we're just delighted so many people were able to be here. We're also delighted that there are many people who are joining us today through webcasting. And I just want to mention that in addition to live webcasting of the workshop today, all the presentations will be posted on the forum website, and so they'll be archived and available for people if they want to view them in the future. So keep that in mind, and you can let your colleagues know. And I want to welcome everyone who's with us through webcast this morning as well. Which is a couple hundred people, by the way. Which is a couple hundred people. Right, so we're very, very pleased. So I'm just going to make a few comments and then turn it over to my colleague Jack Rowe, who also wants to make a few comments of welcome. And what I thought I would do in my welcoming comments is to kind of set a context for why we're here today and kind of what has come before. In doing so, I want to acknowledge the role of the Institute of Medicine in the area of disability over the past 2 decades. The Institute of Medicine has been a tremendous leader in this area, starting back in 1991 when they released the report, Disability in America, which is really, it's become a groundbreaking report in the field of disability and disability research. It was co-led by my colleague here on the left, Andy Pope. And that was followed in short order in 1997 by another IOM consensus report entitled Enabling America, which pushed the envelope even further. And then more recently in 2007, the IOM released a third consensus report called The Future of Disability in America. And those of you who are not familiar with these reports, I would encourage you to take a look at them. You can find them on the National Academy's website. But I think they've really done a wonderful job in trying to set some national priorities for us as a nation with respect to disability and the challenges faced by persons with disability in our society. But over the years, what we've also recognized, particularly when we did the 2007 report, is that if you look back on some of the challenges and priorities that we identified in 1991, we still face those same priorities as a society today in 2012, heading into 2013. And so one of our big challenges is how do we move from consensus recommendations and priorities to action, to change as a society, to better address the challenges that persons with disability face in their lives. And so I was extremely excited when Andy Pope and Rick Erdman and others at the Institute had been initiating the development of a forum on aging and disability. I thought this would be a really promising way to move the agenda toward action and not just recommendations. And so I think this is an exciting first step in the work of the forum. And to talk more about the forum and the workshop, I'm now going to turn it over to Jack.
Well, thank you, Alan, and again, thank you to all of you who have joined us. Those of you who are familiar with the Institute of Medicine will probably have had more experience with another of the Institute of Medicine's core products, we might say, which is a typical study where a interdisciplinary committee or group of scholars in an area is brought together for a defined period of time with a very carefully defined scope of work. And generally after 2 years or so, a series of specific recommendations are made which work their way through the agonizing National Academy review process there have been many of these studies, and you're probably all familiar with some, such as the Quality Chasm study, the study just a year or two ago on the future of nursing, which really attracted unprecedented attention, and so on. Um, More recently, not very recently, but over the last several years, the academies have developed a second product in this product line, has a different style, and this is called a forum by some people and a roundtable by others, and that's what this is. And the intent of these activities is to bring together a somewhat broader group of stakeholders, so we would have more advocates in these groups and not necessarily quite the same proportion of academics. To have a more flexible and broader agenda without a narrowly defined scope of work, rather than to have a set of recommendations that are approved by the Academy. We wind up with things like today's workshop, edited volumes, and a variety of different kinds of activities. The focus of a forum or roundtable varies dramatically. One of the longer running and more productive ones has to do with the healthcare system, as you might imagine, and the value of proposition in the healthcare system. Ours is related to aging, disability, and independence, and was developed in recognition of the longstanding need for a greater intersection and harmony between the fields of aging and the fields of disability. This is not a new idea, but it is certainly an idea whose time may have come. And it's reflected in reorganizations in the federal bureaucracy with respect to services for people who are aging in communities as well as people with disabilities, and reflected in a number of research activities as well. So our focus in the forum, which is represented here by the people sitting around the table, more or less, as opposed to the people on the perimeter, although I would have to say that also, unlike the typical study, we are very much information. We seem to be constantly information, and that's good because we identify individuals and organizations whose work is clearly aligned with ours and who can strengthen our efforts. But our focus can be most easily, but perhaps simplistically, divided into two areas. One is the changes with advancing age that are associated with losses of function, increasing disability, not just at the old section of the population, but throughout the adult population, and what the forces are that are increasing or decreasing those disability trends, and how can they be modified, and what are the implications for our society of those trends, both for the workforce and for the various programs that support people with disability going forward, and what kinds of research opportunities are most important. The second arm of our work relates to individuals, adults, who have disabilities for whatever cause, and who are aging with them. And they develop many what is often referred to as secondary disabilities as a consequence of the interaction of aging and their disability. I think our initial bias is that many of those secondary disabilities could be prevented, that it's not driven necessarily by age per se, but by other characteristics that are associated with aging, and which could be better managed or prevented and mitigated, which would in fact result in significant increases in function in those individuals. So those are the two general arms. It's self-evident that there are many modifiers to disability, and among one of the more obvious ones is technology, which is why we've decided to have the first workshop here of the forum be on technology, and to look at the opportunities that technology presents to reduce functional impairment, and particularly focus on those technologies that are almost here. So we're not particularly going to focus on a standard wheelchair or a crutch, nor are we going to particularly focus on some idea that somebody has in their mind about what kind of a technology there might possibly be someday that could help somebody. But we will try to focus in that part of the spectrum where the technologies are emerging, and try to understand how they can best be developed, perfected, and applied. So, so that's our general focus, and Alan and I would be happy to answer any questions. Otherwise, we'll just move ahead with the agenda.